Does folic acid help reduce the rate of birth defects? What is folic acid? Folic acid is a form of vitamin B9. It is found in leafy vegetables, yeast, mushrooms, and beans. It is the synthetic form of folate. Folic acid is easily absorbed into the small intestine. Flours and grains are fortified with 140 micrograms of folic acid as of 1998. Cooking leads to a loss of folate due to leaching into cooking water. Folate requirements are high in rapidly dividing cells, such as cells in the gut and red blood cells. Folate works with vitamin B12, so if there's a deficiency in one, it is often hard to distinguish. A deficiency of vitamin B12 is anemia. Folic acid in pregnancy. Have you ever wondered why doctors recommend folic acid supplementation for pregnant women? Doctors commonly recommend expectant mothers or women planning on becoming pregnant folic acid. The recommendation is to reduce the chances of neural tube defects. But is there actually research to support this? What is a neural tube defect? NTDs occur when the neural tube does not close properly. The neural tube forms the early brain and spine, and it develops early in pregnancy. The most common NTDs are spina bifida and anencephaly. They can be diagnosed before birth through blood tests, prenatal ultrasound, and amniocentesis. In the study, Birth Defects in Arkansas, Is Folic Acid Fortification Making a Difference? The research took data from the Arkansas Reproductive Health Monitoring System and checked for 13 different birth defects with prior evidence supporting a protective effect of folic acid or multivitamin. This was a meta-analysis study to identify a specific period when prevalence may have changed for these defects. Birth defects were put into a pre-fortification time period from 1993 to 1995 and a post-fortification period from 1999 to 2000, when all conceptions would have occurred after fortification became mandatory. What was found? It was found that prevalence decreased between the pre-fortification time period and the post-fortification period for spina bifida, orofacial clefts, limb reduction defects, umphalically, and Down syndrome. The only significant difference was the one with spina bifida. It is concluded that the prevalence of spina bifida has decreased since folic acid fortification of grains was implemented. Hormone molecular biology and clinical investigation. This was a human clinical study. In this study, 45 women were divided into two groups. Group 1 received 5 milligrams of folic acid per day, while Group 2 only 0.5 milligrams of folic acid per day. The biochemical variables of the serum of pregnant women were studied at the beginning and again at the end of the study. What was found? There was no difference in the effectiveness of folic acid in the high and low dosage groups, thus proving that high or low dosages are similarly effective. Low and high dosages of folic acid were both safe and effective at reducing levels of plasma homocysteine in pregnant women, which can lead to unexplained fetal loss, placenta-mediated complication, and fetal neural tube defects. Homocysteine and oxidative stress in Egyptian children with Down syndrome. This was a human clinical study. This research paper studied the levels of folic acid and vitamin B12 in mothers bearing Down syndrome babies versus mothers who had babies without Down syndrome. The babies without Down syndrome were considered the control group. 42 mothers with previous history of bearing a Down syndrome baby with karyotypically confirmed full trisomy 21 were included. 48 healthy mothers with their healthy children were considered as controls. Serum B12, folic acid, total homocysteine, Vitamins E and C, TBARS, and trace elements were estimated. What was found? It was concluded in the study that abnormal folic acid homocysteine metabolism is a marker to identify women at risk for having a child with Down syndrome. Overall, this direct correlation proves that there is a true significance to folic acid and birth defects. As most scholarly articles classify Down syndrome as a birth defect and has multiple factors that influence the likelihood of a baby being born with it. Abnormal folic acid homocysteine metabolism is a marker to identify women at risk for having a child with Down syndrome. Takeaways. Folic acid is a proven method of reducing the risk of neural tube defects. High or low doses of it are beneficial at reducing this risk, and those pregnant or planning to become pregnant should supplement with folic acid at a minimum.